Assalamu alaikum. My topic is on global epidemiology, especially about the coronavirus, how coronavirus is spread, and what we learned about the coronavirus from the still the starting from the till now. There's a dashboard that the current coronavirus, confirmed coronavirus cases, deaths, and the recoveries. That the confirmed more than 123 million confirmed cases, and these are the countries who have the largest number of confirmed cases. Is the deaths around 2.3 million, and more than that, and they are the most the deaths in the countries are the largest, greater deaths in the recoveries, and the most recoveries in the countries. And this is the graph which is showing that the person and how the person is more elder, then he get more chances of getting the coronavirus. A person who is more than the 65 have the largest chance he can get the coronavirus and show the symptoms, and mainly can need the ICUs and the more emergency needs. Uh, that's why we are taking the care of the older people, that we can get this diseases, get rid of from this disease. They are the how it gonna spread. The person who is affected with the coronavirus is not following the SOP, not wearing the mask, and he is talking to the another person, or talking or moving around the person who is not coronavirus, is moving around the person which have the coronavirus, and the affected person and doesn't know about the coronavirus, or he know about the coronavirus but not following the SOPs, can increase the rates of the coronavirus. Like the person who is talking with another person, affected person talking with the unaffected person, then he can spread by breathing, or by breathing, or by breathing, or by the droplets on the other person. He can get infected person can get the coronavirus. The entry points of the coronavirus are eyes, nose, or a mouth. Some studies also show that the affected person's urines and faces also have the little kind of the viruses. That means the virus can spread through the waste of the humans. And these are the person how the most coronavirus can spread. The coronavirus can spread through the person to person. Mostly the person to person coronavirus can spread. Like the person who is affected, but he not knowing and not uh, following the SOPs, by his cough, sneeze, and singing, talking, and breathing can affect can easily spread and viruses. Airborne air. If a person is breathing, then he's spreading the it's very small kinds of the virus on the air, and the person around him can get the virus. There are the symptoms. Many symptoms. A person got the coronavirus. He have almost 5 days by starting the symptoms. After 5 days, he have got the system, and more if you have got the coronavirus, and more than the 9 days, he can show the little very mild symptoms on it. And the many condition at the right, it can change on the person. A person have the healthy person means he's not any bad diseases, more about that he can easily get back, and easily get easily back from these diseases. Yeah, this graph is showing about the pre-systematic and systematic transmissions. Pre-systematic transmission, and this is the graph of showing the of the person who is person that is randomly testing graph. The person the randomly test, and then they're showing the graph symptomatic graphs, and the non pre-symptomatic graphs. And they also there the which a person who got the coronavirus, and then by the tracing through the tracing you find the cases there. Then this is the graph. Transmission, how the COVID transmission transmitted more by the when the crowded person enclosed, and when the crowd enclosed in a very small space, and where there's no ventilation process, the very bright a very bright chance that everyone can got the coronavirus. The transmission risk increases when it close the when it, in an enclosed spaces. When we tied the people in the when many people get in a small room, and how longer they live, how longer they stayed there, there's very great chance of getting the transmissions or getting the coronaviruses by air, by droplets, or many ways. These are the not non-pharmacologic preventative interactions. That means they are not scientifically proven, but by following, we have you are getting the low chance of getting the coronavirus. So if a person get the coronavirus, he have to isolate it himself, and the person who is with their contact and the person got the coronavirus, they the contact list, and then you also quarantine themselves because and no one knows who knows who get the coronavirus. This and the washing the hands, and these are the for everyone washing the hands with the soap and the water, maintain social distance 6 feet, and the wearing the mask, and the wear the cloth face cover in the public with the face, and the practice is and the practice about the this and the by cleaning the surfaces because the coronavirus can live around on the metals. Coronavirus can live more than 2 or 3 days. By cleaning, by disinfecting the surfaces, we have the less chances to spreading of the coronavirus. And this is preventing self-transmission based on the evidence. These are the evidence. They are the evidently proof that through this we are following this, we can get we have very low chance of getting the coronavirus. And by personal protection, if a person want to protect himself, let maintain the 1 meter distance from the everyone, or hand wash using the hand wash transmission and contaminated surfaces. Hand wash and the by washing their hands and by cleaning the surfaces what he when he before he touched the surface by personal protecting equipment PPEs. And this is the PPE for especially for the health workers, which is very special equipment for the health workers, and protecting others with covering the nose, mouth, and by physical distance. If you get the coronavirus, if you want to protect others from this, by cover your nose and the mouth, and then maintain the physical distance. Here, elder peoples, and those with comorbidity. Elder people, especially those who have any type of disease like diabetes or any related things. If you are the railway cars and other confined spaces, the poor ventilation confined space, and leave the crowd. And if you are getting the places, we have the very large crowd and a very and very low ventilation, that we have to avoid them. And this is about the and about the we have starting of the corner, we are getting the news about fake news, conspiracy theories like the coronavirus especially spread on the winter, not on the summer. This is the graph shows about this is a WHO graph by the local transmissions. And this is a graph when it depend on the temperature. That means the temperature is on minus 10 to 30. They're the chance of the gravity. So how the temperature increases, the chances of the spreading of the coronavirus also increases. The imported cases only, and that means the cases which are from the another place, and the local transmission which are getting on the transmitted place. This by the temperature and by the humidity. How this also the humidity increases, the chances of getting the coronavirus also increases for local transmission or as well as imported cases only. Imported transmission which are moving from another place to this place. And this is the graph like the situation. And this is the graph like if we have this is the this coronavirus can end through these ways. This is the ways that we can peak valleys, and this peak valleys means got the high cases, then low pit, then pit high, then high, then low, then peak. This is a very damaging piece and very harsh periods. And this is the very dangerous period. This is the called very huge peak, then the following the fallback of the coronavirus. This is the slow burn. Yes, there's a huge peak and the very low peaks, and this period is very long period. But through this period, we can prevent and the low death ratio. Deaths are the considered the deaths in the deaths in this and this in this. That's the people who have deaths and the can get deaths. But we can through this we can spread the way of if people get virus in a 3 days by doing the slow burn by following the SOPs, we can spread it from 3 to 10 days. We have chances to for another person who get the coronavirus from preventing and doing anything. This is the elimination. How New Zealand get the back from the coronavirus cases. This is the 26 Feb. He got the first case of coronavirus in New Zealand. Mid of the March, recognized insufficient current testing and the contact tracing capacity, and switched from the mitigation and elimination approach. By insufficiency, by spreading the coronavirus, he found out that he have very low insufficiency. They are increasing the sufficiency, and they start tracing capacity. They are increasing tracing capacity, increasing the testing, and then doing many things. After the mid of the March, after the 26th March, they implemented strict lockdown from the countrywide to the 7 weeks. After the and they are on the alert level 4. Matlab they are very large alert level at the military and the many things, and everyone no one have the moving from there. After all these implementation, they are the also the very low chance of the chance of people getting the coronavirus is very low. After last known COVID-19 cases isolated marking and of the community spread. And last recorded isolated marking. इसके बाद after that the coronavirus case is spreading, and the last when the last COVID-19 they isolated themselves, and by the all the doing these things by the all by the community. If by the person get the coronavirus, you can uh, give the information to to the government, and through this you can do the contact tracing and the many other things. Like the person also, every person get they can isolated themselves. After the all the pandemic added there, after June 8 he got the first case of the coronavirus, where the such Pakistani goes and went there and spreading the by not by the mean, but they the Pakistani spread the coronavirus from there. After that, they isolated them, and after they completely eliminate all the cases. Up now, they are facing the traveler keep the anyone who want to move in New Zealand, he keep the quarantine himself for 14 days. Now the vaccinated passport is required for every person. Through this, our New Zealand move from the diseases. Yeah, the main thing with the time is not the condition of the time is that we can pass this. The way how we can spread the movie from this share. Like if we are getting the cases again more, how we can do getting the more we can stop getting the more we can do the lockdown, and then by providing food to the shared foods and many things to the person. Through this we can lower the chances of getting the coronavirus. And so this is that's all. Thank you very much.